Welcome to this lecture. Today we'll be discussing antifungal drugs. Today we'll be discussing antifungal drugs. So, antifungal drugs, these are drugs used for treatment of fungal infection. So, we'll be discussing antifungal drugs. Uh, these are drugs that we use in the treatment of different fungal infections, and these drugs are categorized into five basic groups. Five basic groups. So, we have the porins, the metabolites, the uh, synthetic triazole, amidazole, and superficial antifungal. These are the five categories. The porins, the metabolites, the synthetic triazole, amidazole, and superficial antifungal. And superficial antifungal. So these are the categories of antifungal drugs. So we're going to look at each drug in each category. So we're going to look at the pollen and fungal. We're going to talk about amphotericin B, which is the most common drug in this category. This drug, potency has, has made it the most widely used antifungal because of its the good potency. So it's widely used for severe systemic fungal infection. So when a client has severe systemic fungal infection, must be given amphotericin B. After an infusion, amphotericin B is distributed widely out of the body and excreted by the kidney. So amphotericin is distributed widely um, through the body and excreted by the kidney. Again, after IV infusion, amphotericin B has an immediate onset. So immediately this drug will start working there and then. The mode of action of amphotericin B, these irreversibly bind to steroids in the membrane of the fungal cell and produce pores or channels that increase cell permeability. The permeability allows leakage of extracellular components which prevent fungal cells from functioning normally as they are. So what usually happens is that the cell membrane of fungi, when somebody takes amphotericin B, it opens those channels in the cell membrane of the fungi, allowing the extracellular to come out of the cell membrane. That's how this drug works. It acts as both as fungostatic and also fungicidal. So when you say fungostatic, it means it just inhibits the growth of the fungi, and when you say fungicidal, it completely destroys the fungi, allowing the extracellular to come out of the fungi. Indication for uses of amphotericin B. So as we mentioned that amphotericin B is used for severe systemic fungal infection. So when somebody has severe systemic fungal infection, is given amphotericin B. When somebody has meningitis, is also given amphotericin B. And also when other than also so it's also given also in candida and also other fungal infections. If amphotericin therapy begins usually with a test dose that is increased daily until the desired dose is reached. So you begin by giving a test dose before you start giving the medication. Duration of therapy depends on the maturity and severity of the infection. So there's no specific duration. Depends on the maturity and severity of the infection. Dose of amphotericin B. So the dose less threatening systemic fungal infection and meningitis. So when the fungal infection is very less threatening, you give 0.25 to 1 gram per kg body weight in IV daily infusion for 4 to 6 hours. So you put in IV infusion for 4 to 6 hours, or you may give 1.5 milligrams per kg body weight every day. The side effects of amphotericin B include nephrotoxic, that's toxic of the kidney, hypokalemia, that's low potassium in the body, abdominal pains, hypersensitivity reaction. So you have to look out for hypersensitivity reaction, chills, fever, anorexia, joint pains, and also headache. These are the common side effects of amphotericin B. Nesting application, this is where nest comes in. So refrigerate amphotericin B until it is used. So if you're learning in health center, you have to make sure that amphotericin B is refrigerated. Is refrigerated. Also, dilute amphotericin B for infusion or injection in dextrose 5%. So when you're giving this drug, you need to dilute in dextrose or in water solution with a pH greater than 4.2 or in stellar water. Stellar water. Now, check the valve vigorously for 3 minutes before administration to avoid particles. This, to avoid particles. So you need to check vigorously to avoid particles in the of the drug. Do not administer solution until the particles have been fully dissolved. You also monitor for blood urea nitrogen and also serum creatinine before beginning therapy. Monitor the patient's fluid intake and output and observe for signs of nephrotoxicity. So you need to monitor fluid intake and also observe for signs for nephrotoxicity. As we mentioned, that it affects the kidneys. Always cover amphotericin B in infusion state with a cloth to avoid outer rays. So when you're giving amphotericin, you need to cover it with a cloth to avoid um, sunlight. So we're going to look at another category of these drugs, nursing. So nursing is used only orally or topically. So it means you apply on the skin to treat local infection because it's extremely toxic when administered parenteral. So oral nursing undergoes a little or no absorption, distribution, and metabolism. Nursing binds to steroids in fungal cells and alters the permeability of the membrane, leading to loss of essential components. So when somebody has taken nursing, what it does, it also binds to the membrane of the fungi and allow the essential component of the fungi to come out. It acts as a fungicidal and also fungostatic agent, depending on the organism. So it can act as a fungicidal or it can act as a fungostatic. Indication of nursing is usually used to treat fungal skin infection. When somebody has fungal skin infection, you can give the drug nursing. And also, this drug is effective against candida. If somebody has candida, it can be given um, uh, nursing. And also, topic nursing. Topic nursing, I talk about the nurse skin, the one we apply on the skin, is used to treat cutaneous and mucocutaneous candida infection. So we're talking about this candida of the skin, infection of the skin, such as oral slash, diapers slash, and also vulvar vaginitis. So when somebody has vulvar vaginitis, we're talking about inflammation of the vulva and the vagina. So this drug is applied on the uh, skin. Although nursing is used to treat intestinal candidiasis, so when you give this drug as oral, your aim is to treat intestinal candidiasis when somebody has candida in the intestine, and they use as adjusted. You can also apply insert vagina application in treatment of vulvar vaginitis. So when somebody has vulvar vaginitis, you can also insert in the area to treat that infection. Side effects: diarrhea, abdominal pains, bitter taste, skin irritation, hypersensitivity. So dose you give 500,000 international units, either TDI or TDS or QID, all in an adult. You can give 100,000 100,000 international units infected via vagina once or twice daily for 14 days. In somebody has valve vaginitis, mention of the uh, area, you can infect 100,000 national units once or twice daily for 14 days. Nursing application, monitor for diarrhea, nausea, vomiting, abdominal pains in patients receiving high dose aspirin, and also inspect the patient's skin regularly for signs of irritation. Expect to discontinue the drug if skin irritation continues. Okay, those are the two drugs in the first category. The second category is the antimetabolites. We are going to look at fructocytosine. Fructocytosine. So this drug is antimetabolite that is used for antifungal activity, used primarily with another antifungal agent such as amphotericin B to treat systemic fungal infection. So use this drug with another antifungal drug. Mode of action is penetrate the cell wall, fungal cell wall, where it is converted into the active metabolite through those last few a metabolite antagonist. So what it does is just it penetrates the fungal where it's converted to active metabolite. So so those fluorophile metabolites. The fluorophile then is incompatible into the RNA of the fungi, altering their protein synthesis and causing cell death. So what it does, it goes into the fungal cell and alters the RNA, leading to uh, disturbing the protein synthesis of the fungi. So the fungi stops growing and eventually dies. Uses of uses of antimetabolites is used in combination with amphotericin B to treat reduce the dose and effects of toxicity. The combination therapy is good in treatment of Streptococcus meningitis. So usually we use it with amphotericin B to treat Streptococcus meningitis. Flutoxime can be used alone to treat low urinary tract candida infection because it reaches high urinary tract. So when somebody has a urinary tract infection, you can use this drug. This drug can also be used effectively to treat fungal infection caused by virus fungal organisms. Side effects, we have bone marrow suppression. This occurs when uh, fructosine concentration exceeds 100 macrogram per ml, may lead to leukopenia and thrombocytopenia and anemia. So when this drug causes bone marrow suppression, it exceeds 100 micrograms per ml because it leads to leukopenia, that's reduction in the white blood cells and also the platelets and causing anemia. So also abdominal distension, diarrhea, anorexia, hypertoxicity that causes toxicity of the liver, also increases the blood urea nitrogen and creatinine levels in the body, and also causes azotemia, that's the toxicity uh, of of blood, and renal phase. Dose um, adult is 50 milligrams to 150 milligrams per kg body weight daily in 4 equal divided dose and administered every 6 hours. Nursing application monitors the patient's fluid intake and output. Notify the primary health care provider if the patient develops azotemia. decrease urine output of all decrease urine output of, of all which may include renal failure. So when the patient's urine output reduces, it can be a sign of renal failure. Monitor also the patient's hematological values. So which means you need to do a full blood count to monitor the red blood cells, the white blood cells, the thrombocytes to see their level. And also monitor the liver function test because it also causes hepatotoxicity that affects the liver. And also creatinine levels. Notify the physician if test results are abnormal. So after you do a full blood count, you see the test results. There's either a reduction in the white blood cells, the red blood cells, also the thrombocytes. You can notify the physician. Um, inspect patient's skin for rash, which may indicate hypersensitivity. Now we're going to look at category 3, the synthetic triazole. Synthetic triazole, we are going to look at fluconazole in this category. Fluconazole is a broad spectrum by triazole and fungal. One is a broad spectrum by triazole and fungal. After oral administration, 90% is absorbed and distributed into the body, while 80% of the drug is excreted as mode of action is a selective inhibitor of fungal cytochronium P450 and steroid C14 alpha demyelination. It causes fungal cells to lose normal steroids, thereby promoting cell death. Indication of fluconazole is used to treat oropharyngeal and oropharyngeal candidiasis. So in somebody that's candida of the oro, given fluconazole, and serious systemic candida is given fluconazole, including urinary tract infection, peritonitis, and also pneumonia. If pneumonia is caused by fungal infection, in somebody you can give fluconazole. It can also be used to treat streptococcal meningitis. In somebody has streptococcal meningitis, you can give fluconazole. Side effects of fluconazole: dizziness, diarrhea, rash, hypokalemia, increased blood urea nitrogen and creatinine levels, and also elevated levels of the AST and also ALT, and also alkaline phosphatase, and also bilirubin levels increases. So these are the side effects. Dose in adults 400 milligrams the oral or IV on the first day, followed by 200 daily for 2 weeks. Making application, monitor the patients who develop rash. Be prepared to discontinue treatment if symptoms continue. Do not administer an IV of greater than 200 milligrams per hour by continuous infusion. Monitor hydration if the patient experiences nausea and vomiting. Administer antiemetic and also diarrhea agent as needed. So we're going to look at the last group now, amidazole group. Amidazole group. Example of these drugs include ketoconazole, clotrimazole, marconazole, atriconazole, teconazole. So all the drugs in this class, the amidazole group ends with solar. Ketoconazole, clotrimazole, marconazole. So we are going to look at ketoconazole. It's a broad spectrum antifungal drug which is more effective orally. It undergoes extensive hepatic metabolism and is secreted through the bowel and the feces. Mode of action: it interferes with steroid uh, since it's damaging the cell membrane, increases permeability. So what it does that it it interferes with the growth of the fungi, damaging the cell membrane and increasing its permeability. Side effects is hepatotoxicity that affects the toxicity of the liver, dermatitis, that's inflammation of the skin, and also insomnia. Patients may undergo insomnia. Yeah, that's just what it is. There's also dizziness, there's rash, there's impotence, there's also pruritus, impotence. Doses 200 to 400 milligrams per oral once or twice daily. Application monitor patient's liver function. Administer it on empty stomach to promote absorption. So Mr. Grant as an empty stomach to promote absorption. Do not administer it with drugs that decreases gastric acid, such as antacids and also anticholinergic. Um, we're going to look at the category number 5, the superficial and fungal. We are looking at the fungals that we use in the treatment of the skin. So good. So far, we're going to look at this last category of the fungal. So the drug comes as a tablet of 1.5 and also 250 and also 500 milligram. Use it to treat antifungal infection of the skin, scalp, hair, and nails, where atopic antifungal has failed. So you give this drug to treat antifungal infection. To give this drug to treat antifungal infection. Dose is 0.5 to 1 gram daily. Duration of treatment. Duration of treatment depends on the infection and thickness of the keratin at the site of infection. At least 4 weeks of skin and hair infection. At least 6 weeks of scalp ring infection. Scalp ring infection, we're talking about when somebody has this area. You can give this drug 6 months for um, 6 months for fingernail infection, 12 months for toenail infection. Side effects: diarrhea, dry mouth, peripheral neuropathy, confusion, impaired coordination, toxic epidermal necrosis, hepatic and renal impairment. Hepatic and renal impairment. Nursing application because the monitor hepatic function that's a liver for the treatment, so need to be monitoring the liver. Monitor blood every week within the first month of treatment. Avoid pregnancy during and the first month after treatment. Men should not father children within 6 months of treatment. So those nursing application need to educate the people to avoid pregnancy in the first 1 month, and also men should not father children within 6 months of treatment. Thank you very much. This is where we're going to end from. So we'll be discussing antifungal treatment and also drugs used in the treatment of antifungal.